I am Dr. Chidanand, Associate Professor of Sociology, SICAV ARS Inamdar Women's College, Vijaypura. I am Nodal Officer of our college. I am speaking remedies of COVID-19. The most number of COVID-19 positive cases have been detected in India and other countries. Coronaviruses are a group of viruses. It was found in China in December 2019. Signs and symptoms include respiratory symptoms and include fever, cough, and shortness of breathing. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and sometimes death. WHO has closely monitored the situation since finding of the first case and has been working with partners to ensure a high degree of awareness. The new virus be found to be sufficiently transmissible to cause society outbreaks. Some viruses are able to cause limited human to human transmission under condition of close contact. As we know that due to coronavirus pandemic across the country, temporarily schools and colleges have been closed. Situation there is an uncertainty when schools and colleges will reopen. No doubt this is the crucial time for educational sectors. However, the media has reported that some people are seeking alternative remedies to prevent or to treat COVID 19. Some of these self styled remedies, including herbal therapies, teas, essential oils, and silver products. There is no scientific evidence that any of these alternative remedies can prevent or cure the illness caused by COVID 19. Standard recommendations to prevent the spread of COVID 19, you can reduce your chances of being infected or spreading COVID 19 by taking some simple precautions as per the WHO guidelines to protect yourself and others against COVID 19. Clean your hands frequently and thoroughly. Use alcohol based hand sanitizer or wash your hands with soap and water. If you use an alcohol based hand sanitizer, make sure use and store it carefully. Keep alcohol based hand sanitizers out of the children's reach and teach them how to apply the sanitizer and monitor its use. Apply sanitizer a coin sized amount on your hands. There is no need to use a large amount of the product. Avoid touching your eyes, mouth, and nose immediately after using an alcohol based hand sanitizer as it can cause irritation. Hand sanitizers are recommended to protect against COVID 19 are alcohol based and therefore can be flammable. Do not use before handling fire or cooking. Alcohol based hand sanitizer it can be poisonous. Use it carefully and remember that washing your hands with soap and water is also effective against COVID 19. Washing your hands with soap and water or using alcohol based hand rub kills viruses that may be on your hands. Maintain at least 1 meter distance between yourself and others. When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth, which may contain virus. If you are too close, you can breathe in the droplets. Avoid going to crowded places like market, bus stand, railway station, some other overcrowded places where people come together in crowds. You are more likely to come into close contact with someone that has COVID 19. Avoid touching eyes, nose, and mouth because hands touch many surfaces and can pick up viruses. Once contaminated hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter in the body and infect. Make confident you and the people around you. Follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue. When you cough or sneeze, then dispose of the used tissue immediately and wash your hands. Why? Droplets spread virus by following good respiratory hygiene. You protect the people around you from viruses such as cold, flu, and COVID 19. Stay home and self isolate even with minor symptoms such as cough, headache, mild fever until you recover. Have someone bring you supplies if you need to leave your house. Wear a mask to avoid infecting others. Avoiding contact with others will protect them from possible COVID 19 and others viruses. If you have a fever, cough, and difficulty breathing, seek medical attention but call by telephone in advance if possible and follow the directions of your local health authorities. National and local authorities will have the most up to date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Keep up to date on the latest information from trusted sources such as WHO or your local and national health authorities. Local and national authorities are best placed to inform on what people in your area should be doing to protect themselves. At the moment, the best weapon against COVID 19 is a strict loyalty to the rules. Among other things, one should avoid social gathering, maintain interpersonal distances of at least 1 meter, possibly 2 meter, and thoroughly wash hands often. Clean your hands often, avoid close contact, cover your mouth and nose with a cloth, face cover when around others, cover coughs and sneezes. Clean and disinfect frequently touched surfaces. If you follow all these instructions of your state and local authorities and current guidance regarding social distancing and other measures to reduce the spread of coronavirus, please please follow all these instructions and save the nation. Thank you.